Inside Government, a program for the fall 20. Good evening and welcome to Inside Government, a program for the fall 2021 semester here at Hugh Community College and broadcast on Spectrum, Verizon Fios, the Auburn Regional Media Access, ARMA, as well as Win 89.1, the college's radio station. I'm Guy Cosentino, your host. While the last month or so we seem to have been taken up by Campaign 2021 that is now in the books, and all that is left is absentee ballot counting and analysis. What is still ongoing is the fight against COVID that saw a spike even after vaccinations were made widely available with the Delta variant, and now new recommendations for boosters and expanding the pool to be vaccinated, those 5 to 12, which I'm very happy about. It was made this week. And so we have asked Kathleen Cuddy, the Director of Public Health, to graciously come back to the studio. She's been gracious enough to come back into the studio. She's been doing this since, believe it or not, March of 2020. I think you were our last guest before the pandemic really hit. So for 19 months, she's been doing a great job talking about what her department is doing in regards to the fight against COVID, as well as their work to minimize the upcoming flu season. And we might even get into a little bit of lead poisoning discussion because you have a large banner downtown. Mm-hmm. So welcome back to Inside Government. How are you doing?
I'm doing all right, and I want to say thank you to you for the opportunity to have these chance to speak to the public about what's going on with COVID. I think it helps a lot for people to hear firsthand and hear conversation.
So thank you. So as of today, we're taping this on November 4th. But I think I've written 2 letters that say November 5th for some reason today. How many COVID cases do we have in quarantine, and how are we doing on hospitalizations?
So we'll be sending out an update shortly. There's about 200 people who are in isolation right now, just dozens and dozens in quarantine. We don't even run the reports.
Isolation and quarantine?
So isolation means that you were diagnosed with the COVID virus. Quarantine means you were exposed to someone who is positive with the virus.
So before we get to hospitalizations, are there any common similarities? Are they young people? Are they old people? Are they across the spectrum?
They're running the spectrum. So a few months ago, we started running our daily updates and breaking age groups into decades to show that it really is all age groups impacted. It's primarily older population, which by the nature are more immune compromised and typically have more chronic diseases. But there's someone in the 10s age group who's been in the hospital for over a week. We had someone in the under 10 age group who had been hospitalized for more than a week.
So I would assume you differentiate between quarantine, isolation, and then there's hospitalizations. How many do we have hospitalized?
That number's been going down. We check the numbers at Auburn Community Hospital and our Syracuse Hospital. So if someone is in Cortland or Rochester, we may not have that record. It's been going from about 20-something down to the low double digits. And without having the data right in front of me, I couldn't tell you today. But we've been seeing somewhat diminishing numbers currently.
So the big question that usually comes out is, are those who are, whether they're quarantined, isolated, not so much isolated, but quarantined or hospitalized, are they vaccinated or unvaccinated?
It's pretty split, the number of breakthrough cases and unvaccinated that we have as far as new positive cases. The hospitalized cases, more so, are unvaccinated, but not exclusively. Without question, the deaths overarchingly are unvaccinated people. Not entirely, but the vast majority.
So why such a high number of people who are vaccinated getting infected?
I think it speaks to the highly contagious nature of the virus right now and the variant that's circulating in our area. I think it speaks to...
Is this the Delta variant?
The
or
Delta
different?
variant
Okay.
currently is still circulating with us. To the best of our knowledge, there are other variants that are around the world. I think it speaks to some waning immunity, which is why there's boosters for those who are vaccinated. But it very much speaks to the interactions that we have with each other. And we only have, of our eligible population, about 53% vaccinated right now. And that's not the higher number that we want.
So I want to get to that in a second, but I want to ask you this question. Does that mean that your predecessor, Elaine Daly, who happens to be a legislator, was on, and we got talking about this because she was talking about public health and this. I think it's in the blood, most likely. But it almost seemed, I interpreted from her comments, but maybe correct me if I'm wrong or validate that I'm right, that we just have never gotten ahead of this, that we do have the variant or COVID continually circulating. We have never been able to get our numbers down enough and our vaccination numbers up high enough to put a dent in this.
No, we haven't so far. And I would say a lot of upstate New York reflects that. I think, unfortunately, so much of this public health crisis became politicized. So the public health response became a banner for some people to wave, which is unfortunate because it's about health. It's about well-being. It's about the safety of our community.
Public health doesn't have a registration.
You've got it.
So because the numbers that you're talking about, and even with the vaccinated, does that mean that the vaccine is not working?
The vaccine definitely is working.
Okay.
There's no question that...
so it could be a lot worse.
Oh, my goodness. When we look at our numbers of people who, when vaccine was not available, you look at last January, February, terrible number of deaths, particularly amongst older population. We are not seeing nearly that response since vaccine has been available to people. In fact, there have only been 21 deaths since February, which is in direct response to people becoming vaccinated.
Has the reduction in the mask mandates, in the sense of if some stores are using an honor system, which I'm not going to ask you to speak to it if you want, I think is ridiculous because we're trying to say they didn't want to get a vaccine, but we're going to honor that they are following a mask mandate. Has that contributed that we're having less people mask up? You had to come on you and I both have masks here. When we stand up, we have to have a mask on this campus. But there has been a massive reduction in private sector mask requirements. Has that driven some of this as well?
It has driven some. There's no doubt that relaxation of preventive behaviors has increased some exposures and consequently some people getting the virus. Where we're absolutely seeing the most number of transmissions and outbreaks are in social gatherings. So that is where people are with each other. They're not from the same household, and clearly they're not utilizing preventive behavior such as masks and distancing.
So you're worried about the next 5 days since Halloween was such a nice evening and the weekend may have driven people for adult parties inside on Saturday?
Correct.
So you're thinking we might get a spike?
I think we may. We're seeing a few cases uptick that we know are related to some social situations, including Halloween gatherings. Hopefully we won't see the numbers that we did last year at this time because people are vaccinated.
So you said 21 deaths since the beginning of the year?
Since February, when vaccine was most available of 2021.
So
correct.
Do we have an idea how many deaths overall?
Overall, what we have recorded are 106 deaths. Could there be people who had COVID and died? Certainly, and that we weren't aware of. But those are what we have on record.
There could also be people who might have been attributed to that but could have died for other.
It's certainly possible.
Are we out of whack with other like-sized counties in upstate New York?
No.
So let's go back to the vaccinating part. 53%. That really means 47% aren't.
That would be correct. So when you speak
I'm not
to
a
going into a store, I think we always have to be aware that more than likely half the people in that store are not vaccinated.
And more than half usually don't have a mask on.
Correct. So just stay aware. Keep your distance. Do your preventive behavior.
Is vaccination now in the hands? You were doing mass vaccinations. There was the state fairgrounds. That's where I got mine. Are you doing vaccinations as a county, or is it now mainly shifted to the Walgreens, maybe Walmart, Wegmans, and Rite Aids?
The Cayuga County Health Department has never stopped providing vaccinations. And I wish I had brought the numbers with me. Someone on our staff, Melissa, had put the data together for us. I was so impressed when you see the number of clinics that we provided, the variety of the vaccine, all 3 of the approved vaccines we have been able to provide, and throughout the entire county, up north, down south, central, schools, senior apartment complexes, the gamut.
So if now somebody is eligible for a booster shot, they can go to any of those public pharmacies or private organizations that I've mentioned. Can they still contact the health department for them as well?
Definitely. So thank you for bringing that up, because we're so pleased that pharmacies are making this available. It just makes it so easy for people. There is no reason if you want a vaccine not to get it. But again, as we are providing booster shots along with first and second doses, and we'll be starting the 5 to 11-year-olds, we have the help again of our town and village clerks and the city clerks. And we're just so pleased because we know that is difficult for some people to get online and register, whether it's access or ability or time. And this is an opportunity to get some assistance. And the Cayuga Community Health Network is also providing that assistance.
So when someone wants to get their shot, I want to ask a little bit about the demographics, because you mentioned towns and villages. Do we know what the breakdown is between the city and more rural parts of the county when it comes, or is it countywide 53%, but could you say there's a pocket that the city's either higher or lower, the North Country is higher or lower? Is there any geography right now?
I didn't look at that before I came on, but I have looked at it in the past. And there is some zip code breakdown that the state provides on their public websites. So people can go and look for that.
We had 3 towns that were near the bottom 3.
We had, yes. And that, it's kind of wonky because, as was explained to me by the people who I work with who live in those towns, the zip code you give, maybe your mailing address, but might not be your town of residence. It was kind of funny.
Well, if you look at Skinny Ellis Senate, perfect example. It's a frisbee throw literally from the studio. Long front. Your sons would be able to hit that.
They might be able to. But I think it was the 3 M's. I said it was Montezuma, Martville, and Mentz, I think, or Meridian. Meridian. And so we made certain that we went out to those.
So are those numbers up?
I think they've improved, but I don't think that they were as terrible as they looked.
So 53%, we are below the state average.
Yes.
Any idea how we can lower these?
Get vaccinated. Get the word out. Get vaccinated.
So what's the county? So let me rephrase that. What does the county need to do that you haven't been able to do, that maybe you need more resources for? And I know the county chair is going to release her budget in an hour and a half as we tape this in the afternoon. What more can be done by the county?
I think if we can dedicate some personnel to help with our marketing and education, but we also have some great partners who are willing to help and have been helping. We need to be able to spend a little bit more time with them and in some educational campaigns and outreach.
When you say a partner, give me an example.
One of the areas where we know within our health department and we know within the community we could focus a little more effort is strengthening our partnerships with our religious community and churches. More than willing. There's a wonderful group of people who send us the information, we'll share it. We'd love to do more than just that. And so hopefully we'll be able to dedicate some of our personnel to work with our community partners more so to promote this.
So part of the job of your department is also making sure that people get tested if they've been exposed. So currently, what type of testing is available in Cuyahoga County?
Testing remains a challenge. There's no question. A year ago, it was a challenge. It still is, and it tends to wax and wane, and it waxes and wanes with, the increase in positive cases, with the hospitalizations, with illness. It accompanies that. Currently, you can get tested at a pharmacy. You have to make an appointment. You can go to an urgent care center.
But those are not same-day results.
They are not.
Is there a same-day results? Other than, I know Jeff Perizzola said in that seed, he said, we've been testing about 15 every Wednesday night.
Right.
But that 15 out of 74,000 people is not a...
That's not a tremendous number. To get a little faster turnaround, it's usually easier if you have the ability to go to an out-of-county testing site, like in Ithaca or Community General, and they create their own specimen collections and do their own analysis on site. So it's a faster turnaround time than having to send a specimen out to LabCorp, for instance.
So you were gracious enough. I was exposed to somebody. I did not test positive, thankfully, for myself and my family, but you were gracious enough to say, hey, this is where you go. And Community General was fantastic, and they've been fantastic prior to COVID. They've always been fantastic, I'll say. But in that particular case, that's also not necessarily 24 hours. They say usually 12, but if you go at noon, it's still going to be midnight. If we don't have the private providers, is this something that we need to have more resources? I mean, you have a limited staff to start with. Do more people need to be hired by the county or by schools or by pharmacies to do more testing? I'm not saying better testing, but more testing, quantity.
Yes, that is certainly one aspect of a solution. It's also having the materials on hand. And this is not an excuse, but it's a reality. There are supply chain issues, and there are laboratory human resource issues. Right? So the emergency room at our Auburn Community Hospital, they can do a test within a few hours, but because of the limited resources, it's for someone who's sick. It is not for I was exposed.
Right.
And so if you are otherwise healthy, you'll probably have your test sent out, which may take a few days to get the results back. So it's resources, human as well as material.
So let me ask you about parents, because this confuses me a little bit here. If a student gets a test, say they've been exposed, or they think they've been exposed, and they get a test, do they need to stay out of school until they get the test results back?
That is recommended because you were tested for a reason. So if you've known you've been exposed and you test, you should stay home till you get the results. If you perform one of the Binex card tests, that's the quickest result. It's an antigen-based test.
And largely unavailable if you walk into any pharmacy in central New York.
They sell out fast. They do.
Literally, after this exposure, in my case, we bought them online so that we have them for us or for a family member who may not be able to walk in, couldn't get it. I literally went to all of these pharmacies with a mask on, which I do anyway, but they're not available.
Right.
So my follow-up to that is, if a parent who has child care issues or is a single parent says, I go in there and I get a test, I got to keep my kid out. Do I not get a test, which is worse to me?
Right.
How do you deal with that?
We talk to them. We explain the benefits. We really rely on parents to be doing the right thing by their children and by the other children and community that they expose. Overall, I'll say, wow, what a challenging time to be a parent of a daycare school-age child who needs to have care or when you need to work. I don't know how much harder it could be. But people are doing the right thing. Employers are being responsive to the need and patient. And it's necessary. We're still in a pandemic. As much as we wish we were not, we are. So if you're able to get those quick tests, that's great. Some pediatric offices are able to provide some testing. Again, it may need to be sent out. There are options, but there's no super easy way to get a very fast test.
So one of the super fast ways that hit the paper today that most likely looks like there's a little bit of a clash here, and I've read the story, but I would like you to explain the story to me, is this, what is a test to stay process?
Mm-hmm. So New York State, we've been asking New York State as local health departments that we follow their guidance. Test to stay is a scenario that is not supported by the State Department of Health, but it's explained as an option if localities pursue it to allow for children who've been exposed to test on a daily basis to remain in school, whereas they may have been in quarantine otherwise and staying at home, and remain in the classroom but be quarantined from every other
So are they same-day tests?
They would be the 15-minute antigen tests that schools have a supply of from the State Department of Health.
And there aren't enough available?
There are not.
Oh, there are not.
That would be one of the reasons
Okay.
why we do not.
So the State Department of Health
proponents.
has recommended against it and said to localities. Now, when I read localities, I'm questioning, is it localities of each individual school district, or is it you and the Cuyahoga County Health Department?
It's the local health department.
So you're not supportive of it. It seems from this story. And you met with superintendents within the last 10 days?
Yes, fortunately, I did have the opportunity. Our superintendents they are wonderful. And what a challenging time also to be working in a school, right? Whether you're the superintendent, whether you're a teacher, whether you're a school nurse, whatever your capacity in the school is, it's never been more challenging. And we certainly, as a local health department, as an individual, I think there's not anyone who won't agree we want to keep our children in school and in the classroom. It's good on so many levels.
So why not use it?
It is a limit as to the number of resources we have. It is a logistical nightmare right now because we won't be able to affirm all those tests.
Oh, did the test come to you?
Every test that's performed has to be uploaded into the state database system.
And that's done by the county?
And the school needs to upload it. We need to verify it.
Okay, so you've gotten some pushback. I'm not clear about Auburn, but clearly Cato Meridian and Moravia have given you some pushback on this, correct?
I think every superintendent would love to see kids stay in school more, and if this is one way it can be done, they'll find a way to do it.
But it sounds like one of them has already
the ability to do so.
But one of them's already said this week they're going to do it.
One of them has articulated the desire to do that, yes.
Okay.
That would not be in keeping with the limited service laboratory certificate, which they're working under, which is that of the health department.
So this could be drawn out as a discussion still.
Yes.
I
will add to that too. We want to be careful, right? Because we want to keep kids in school. We want to prevent the spread of the virus. But this particular school had an outbreak of school-age children. There's a dozen kids, and they had a whole grade go remote because nearly a dozen children are positive. It may not have happened in the classroom,
but they still got
it's
exposed.
School-ager, and it was related to school social functions.
So not that this is ever changing, it seems every week, but now this week we have the federal government now saying two things. One is the issue of any employer 100 above. The Biden administration made that policy this morning, or made it public this morning. Right. Will that rest with you to enforce that? Or how is that going to be enforced on the 100? Or do you not know yet?
We don't know yet. That's been a challenge right along, too, is sometimes the government makes a determination, but the information does not come out to the localities as soon as we would like it.
So the bigger issue here is now we have 5 to 12-year-olds who can be vaccinated.
Yes.
So does that mean that the county will be setting up? So before you came on, I told you there's a report in the Post-Standard that Onondaga County set up something for Saturday. They're already booked out. So if you're watching this at 7:55, p.m., will the county be setting up mass vaccination sites?
Yes, we will. And that goes back to some of these school functions. It's not always about supply and human resources, but the goal is the end result. And the best way to get the end result is to get vaccine. Because if you're vaccinated, you're going to stay in school. You will not be quarantined if you have received your vaccine and you are asymptomatic, even if you've been exposed.
So let's make that clear. So if I am at Owasco Elementary School bad example, because right now a regular case could be right next door at the junior high. If I am vaccinated and I am sitting next to somebody who's been exposed, because I am vaccinated, I do not have to quarantine, correct?
If you are vaccinated and do not have any symptoms,
Okay.
you will not be placed into quarantine. You will continue
But
to go to
that is
school.
not the case right now of elementary school children.
Correct.
If they are, because they're not vaccinated as of this morning.
Elementary students haven't had that opportunity until just this week. But there have been some modifications made, from last spring to this fall, for example. We previously, in a classroom setting, had quarantined everyone in a 6-foot radius, but now it's a 3-foot radius. And the other preventive measures that schools continue to perform, hand washing, mask wearing, that all benefits us.
Do you think that there is a likelihood, as you've listened to the state health department, and I know they're going through some leadership changes, and the governor, that you will see a mandate for 5? They didn't do it for 13 and above, but do you think now at this point they might go to a mandate from 5 to 18?
I think they'll wait to see how things roll out and how much people voluntarily take part in this. And we will be having vaccination clinics. We'll be going to the schools. We have some dates set up for that. And we will be having mass vaccination
clinics. And parents will
clinics.
be allowed to come in with their child.
There will be the spectrum of choices dependent on the school district, whether you sign off with permission or whether you accompany your child. And we will have clinics at the mall.
So one thing that children 5 to 12 fear are needles, which can be a good thing in some cases. So the annual flu vaccine, there is some nasals. It's limited. There is no nasal for COVID.
There is not.
Do you see that coming?
I think there's going to be a lot of options down the line.
But that could be 2 or 3 years.
Oh, right. It's not an immediate one to my knowledge.
And so from what you know, do you think these boosters will be an annual item for children as well as adults?
So the research hasn't been completed in that regard because enough children haven't been vaccinated. But I won't be surprised if that happens. And in my mind, a booster shot, no big deal. Get a booster shot.
We got about 5 minutes left. It's a signal to the control room. What do you think is the biggest challenge you're going to face? I mean, we just talked about Halloween. What do you see as the biggest challenge between now and when we have you back in February?
Getting our children vaccinated in a timely manner, as many as possible before the holiday gatherings happen. Because I really do think as we see these numbers increase, we're going to have a lot better spring semester for schools and much fewer children going into quarantine.
So I want to ask you about 2 last items. One's compliance, specifically among your own staff, as well as the flu, because I don't want to end without that. And that's why I'm asking for a little bit more time from the control room. So how many employees does the health department have?
Give and take, but around 40.
The governor has mandated that all healthcare providers have the vaccine. That includes your staff, correct?
Correct.
What's your percentage of compliance at this stage?
We have 100% compliance at this stage.
Did some people choose not to?
Correct.
And they're no longer with the county?
Yes, one person retired and one person resigned.
And you use also independent contractors? That's
Yes.
my term. I don't know if that's what you
Yes.
use them. How many are there, and what do you use them for?
So contact tracing is an example of independent contractors. We subcontract to an agency, and they have to be vaccinated if they are in our building at all.
And what percentage of vaccinations do you have there?
100%. If they come into the department, if you work within our department walls, you must be vaccinated.
So you've lost some people. Has that created some critical gaps for you?
There's no question that the waxing and waning of jobs, we have had attrition issues that are normal for any agency, and it's been very difficult to find the personnel to fill those roles. We've been given the permission to do so, but it's really finding the skilled people to fill them.
Okay, so I'm going to ask you a question before we get to finalizing flu. I think as a public health official, I'm not talking about you, but somebody who works in public health, you'd see the value and the efficacy of being vaccinated. Can you give us the counteroffer? I'm not saying you agree with this, but what's the counter? What are you being told why people don't want the vaccine?
So it's really taking the time to have conversations. Some people are scared because they feel it was too new of a vaccine. Some people feel it's my civil right not to have to be vaccinated. I think it's really...
Even though I have to be vaccinated for rubella, mumps, measles, the whole slew.
Correct. I think more it was unfortunately because of the politicization of this. But education and speaking to how the vaccine was created and how it works within your body and how it benefits you, getting the vaccine or any concern about any effect for a few hours after you get that vaccine far outweighs getting COVID.
So those arguments just weren't justified as far as you're...
They're not justified. They're understandable, but with education, they can be countered, I believe.
I want to finish up with the next 2 minutes. Just, you're fighting COVID, but you got to also worry about the upcoming flu season.
Right.
I don't know. Is it officially upon us yet?
It is officially upon us.
So last year, the flu season was mild. I think that would be the term for it, in part because we had less face-to-face contact and others wore a lot of masks.
Right.
Would you agree with that analysis, first of all, about
Absolutely.
last year?
Absolutely.
So still on this front, forget the COVID issue. Is wearing masks during flu season a good idea anyway?
It really is. It really is. Yes.
So why should somebody get a flu shot?
You should get a flu shot to prevent from getting the flu, because the effects and the illness that you can get that affects you individually and can expose others. Very similar to COVID. You can get very sick from the flu. You don't want that. You feel lousy. Most people make it through. Some people get terribly ill. There are people who die every year from flu. By taking the preventive actions and getting tested to see if you have flu helps provide the appropriate treatment. But it's best to prevent it in the first place. Get the vaccine.
And you don't want it compounding COVID as well.
Oh, that is just going to be awful. If your immunity is down from one of these viruses and then you get the other one, it's just a slam.
We didn't get to lead. I know you have a banner downtown. I'd love to have you back in February or members of your staff to talk just about lead.
That would be wonderful.
Because that's important to our community. But we do want to thank Cuyahoga County Public Health Director Kathleen Cuddy for coming back into the studio as you've done since this all started and before. So we appreciate that. Continue the good fight to fight COVID.
Thank you.
And keep the flu season down. And we encourage you to go out there. If you have not been vaccinated, I encourage you to go. I'm not speaking for anybody else. I encourage you to get vaccinated. 43% for Cuyahoga County is way, way too low. If we're going to fight this and defeat this, we need to move forward. Wear a mask. It's important. If I could have mine embroidered that says, I have a 9-year-old, I would. But wear your mask. We'll be back on Tuesday with 2 back-to-back Inside Governments. First with Auburn Mayor Michael D. Quill, giving us a city update, and then Cuyahoga County Legislative Chair Aileen McNabb Coleman. As I mentioned a few minutes ago, she is presenting her 2020 budget for the county today, and we'll talk to her about that. We'll finish our fall season with 2 Inside Government shows next Thursday on Veterans Day with New York State Senator John Mannion and then New York State Assemblyman John Lamadas. Before we go, though, we thought we'd like to let you know that you can send us your ideas for future guests or questions for upcoming guests to Beyond the Front Page or Inside Government at cozguytho@aol.com. I'm Guy Cosentino for Cuyahoga Community College. I want to thank you for watching. We hope you have a good rest of the week. We hope you'll come back and see us on Tuesday with our 2 county and city leaders. Have a great tomorrow. Be safe, be well, get vaccinated, wear a mask.